Okay, folks, I've got discussion D for you. We're discussing the deadly consequences of rural hospitals closures. Those hospitals that are out in rural communities who serve like far reaching areas. So here we go. The phrase, the deadly consequences of rural hospitals closures, describes how shutting local hospitals increases preventable illness and death in rural communities by removing nearby emergency, inpatient, and specialty care, worsening outcomes for time sensitive conditions and chronic disease management. Meaning of the phrase: the the asserts a directly it asserts a direct link between hospital shutdown and increased mortality and, and severe health deterioration in affected areas. Not only economic pain, but measurable declines across time access to timely life-saving care. Evidence, evidence, and real-world examples. Families and first responders report worsened, sometimes irreversible conditions and documented deaths after nearby hospitals close, such as multiple closures in western Wisconsin that forced long drives for urgent care and were described by local responders as causing loss of life. National national analysis shows hundreds of rural hospitals closure over the past decade and rising risk for many more. With closures uh, concentrated in states that did not expand Medicaid and in communities with older, poorer, sicker populations. How closures translate to deadly outcomes: increased travel time to the nearest emergency department, delays treatment for strokes, heart attacks, severe infections, traumatic injuries, and obstetric complications where minutes matter, where minutes matter, raising mortality and disability. Loss of local inpatient and diagnostic capacity forces transfers and repeated long trips that can interrupt community continuity of care, cause tre- cause treatment delays, and drive clinicians away, reducing local expertise and capacity. Economic fallout from closures, job losses, population decline, and reduced primary care access worsens underlying health detriments and chronic disease control. increasing community vulnerability to acute crisis, policy implication and responses, strengthening rural hospital finances, expanding insurance coverage, and give me 1 second, guys. Targeted investments in workforce, ambulance transport systems, and telehealth can mitigate closures and their deadly effects. Policy proposals that cut Medicaid funding or fail to respond to replace lost revenue threaten to accelerate closures and the associated harms described by clinicians and communities. Okay, guys, so that is D for you. Might jump back on later for shows after dinner. Until then, get a wellness. Take care, folks.